Hello, this is Debbie Lynn Toomey, Tufts Medical Center's Injury Prevention Coordinator, and you're watching Aging Strong, which is sponsored by the Quincy Health Department. Today's topic is on Go Plan, which is really exciting because you just never know when you have to go. And of course, it's always good to have a plan when you do need to go right away in case of any type of emergency. And today's guest speaker is Eileen Gerhardt, who is the owner of Beacon Patient Solutions. She has a wealth of knowledge as far as many topics that has to do with patient advocacy. Welcome.
Thank you.
Yeah. So I know you have a beautiful PowerPoint to show us and to share with us, and it's really very interesting. And I have a lot of questions for you already, but can you just share with the viewers out there why do you think this type of a plan, a goal plan, why do you think it's important?
I think it's the kind of thing that we should put together and hope to never use, right? So it sits in the corner gathering dust, or sits on a bookcase gathering dust. But the importance of it is to prepare for uncertainty, which sounds kind of like an oxymoron, right? Wait a minute, the event is uncertain, I don't know. But how we plan for something, what we have available to us when an emergency comes up is really important. And the best time to think about that is ahead of time, proactively.
Yeah, I totally agree, because as you're sharing that, it just brought me back to when I used to be a bedside nurse. And that was many, many moons ago. But we always had a fire drill, right? We have what's called a code cart, which is a red cart so that nobody, will, miss it because it's red. Mm-hmm. And it has different shelves. It's almost like one of those craftsman tool box. It's one of those things that's on wheels. It has medications if your heart stops. It has medications if you need IV fluids. It has all these different types of emergency medications. And we always have to go through it to make sure that nothing has expired. We have to go through it so that we know and remember what's in each shelves. So I totally understand that from the perspective of being a nurse. Got to be prepared for the worst.
Mm-hmm. And by having that organized and doing some of the work ahead of time, when something is needed, you're able to grab it and go, whether that's written information or literally putting together a bag that might have different resources for a medical or another type of emergency.
Yeah, yeah, definitely another type of emergency. Because you never know. Could be like, we don't really experience tornadoes around here that we have to evacuate, but some people live in flooding areas, or you just never know when a temporary evacuation needs to be done because of weather-related issues. Yeah.
I have a number of slides. Of course, they have a lot of information. The beauty of being able to watch this via a recorded tool is you can press pause at any point. Mm-hmm. So I know some of the slides are dense with information, and hopefully those technological tools will allow for greater access as well. Debbie had asked for me to share with you how to create a Go plan in case of medical or really any other kind of emergency, those prompts you need to put that plan together. So this morning, or today, depending on when you're watching this, we'll discuss how to prepare, how to organize, and different things to think about ahead of time so that we have some control over the planning, even when it comes to an event we're uncertain about. So it's always good to think about planning in different ways. You can think about it sort of in the Yogi Berra way, that if you don't know where you're going, you'll end up somewhere else. or the more practical way of John F. Kennedy's quote that the time to repair the roof is when the sun is shining, right? When it's not leaking into your home space. And so to do things proactively as much as we can. So it's really important to think about what are the things that you can take care of today to have a plan in place. So one thing people may not give thought to is knowing specifically what hospital or other care facility is closest to you and also in your network when it comes to insurance coverage. That's really important. So whether that's private insurance, Medicare, Medicaid in Massachusetts, Mass Health, supplementary insurance, it's really important to have a clear understanding of what facilities are covered by your insurance network. And it's also important, and this is where ahead of time can really play a role, to ask an emergency room staff member if the billing department at a hospital, if they contract with out-of-network providers or providers who don't take insurance. And that means that you're prepared for if you might have to navigate a bill or a fee related to something out of network. You want to know that ahead of time if you can. The other thing you can do, there's a fabulous tool by an organization called Leapfrog. In addition to your state websites that give you all kinds of resources about care facilities, hospitals, physicians, other providers. But Leapfrog has something called the Hospital Safety Grade. And you can search it by state, by city, and you can read about the various hospitals and the kind of care that they've delivered and the grade that's been assigned through a specified set of parameters. And it's a really useful tool. So the other thing you can do, in addition to using hospitalsafetygrade.org and comparing hospitals, you also have the ability to do so via a Medicare website or something called Health Grades. There are a lot of different ways to research that information so that you have a good foundational understanding of the kind of care being delivered. Here in Massachusetts, I specified how you look up on the Massachusetts Department of Health and Human Services. They're looking up a physician profile, but that is available on any state's website, regardless of where you're located. You would just look up physician profiles, and also you can look up the state medical society and read about physicians as well. The other thing I recommend, and something we can do ahead of time, is that we can make sure that some of the tools we might want available to us, should we have a hospital stay, are already on the devices that might come with us, whether that's a phone, a tablet, a laptop, some other electronic tool. You can download some of the video chat applications you might use to communicate with others ahead of time. And so here are some examples: WhatsApp, Facebook Messenger, Google Meet, Apple's FaceTime, and certainly Zoom, just to name a few. There are a number of other tools, but to just think about, oh, what might I want available to me, and to make sure that they're already on the devices you might plan to take with you. There is a great resource called the File of Life, which is a document that comes in a bright red vinyl pouch with a magnet on the back. And it's intended to, you fill it out, you make sure you note what the date is that you filled it out so that you have the most accurate information. And you have the basics of emergency contacts and other information related to your prescriptions, etc., on there. And that actually, because it has a magnet on the back, can go on a refrigerator or something else magnetic, or put it up in your kitchen. But that's where first responders are often trained to look for information if the patient they're assisting is unable to advocate for themselves. It's a useful tool to have, and it's often available through your area senior center. Sometimes they're called councils on aging. They could be a community center. Sometimes it's available at the fire department or at the police department in one's town. They're available in different places, but this is what it looks like. It's a double-sided card that folds, has the basic information on it, and it's really useful to have filled out. It also is a great prompt for things that, oh, I really should have that information at the ready. So whether you use a tool like this or another one, it gives you some prompting for what might be most important to have accessible in an emergency. So the File of Life, as I said, is something that is often available at a variety of community organizations. It's the kind of thing that you want to make sure you update and have current. And you can also keep copies of it in places like a wallet, a purse, a backpack, a car's glove compartment, etc., so that you have that basic, accurate information available as it might be needed. So another way to go beyond just written information is to consider putting together an actual bag. They're often, as people are preparing for the birth of a child, it's encouraged for someone to put together a go bag that at the time they need to go to receive medical care for that birth, they have the things that they have thought about ahead of time they want with them. And so this is a modified version of that. And it's really about thinking, okay, if I needed to leave my home due to, in this case, a medical emergency, but you can sort of flesh it out to any kind of emergency, what would be helpful for me to have with me? And so definitely that organized paperwork, and the next slide I'll flesh out what that is. Some equipment you might want with you, various chargers, other kinds of tools and devices, and any kind of personal items. And so to consider putting that together in a bag, and as I said at the beginning, with the hopes that it sits in its location and it just collects dust, right? We don't need it. But if we were to need it, it's up to date and it's ready to go, and it can just go with us. And one of the times this became so important was at the height of the pandemic, when people were traveling and going to healthcare facilities on their own, unable to be accompanied by somebody else. Having the information about the individual and having the tools and resources one might want or need already put together to go with you became very, very helpful for people. So it's never fun to organize paperwork. You know, it's much more fun to do other things. We as humans like to procrastinate, and so sometimes things like putting together our personal health record may be something we have planned to do, but have not yet done. but I recommend putting it together, having basic information about you, name, blood type, allergies, emergency contact names, etc. Copies of driver's license, front and back of insurance cards, whatever kind of insurance that is, an accurate medication list, which includes the dosage, frequency, when it's taken and why it's taken, a medical summary, including sort of critical pieces in your healthcare timeline, and some screening tests, and making sure that you also have some completed documents with you, including a HIPAA release. So that's a release for a healthcare provider to be able to speak to someone you designate to be able to get healthcare information about you for the purposes of helping you out. And also advanced directive documents such as healthcare proxies, living wills, and personal directives. And so even in 2024, even as we're having this conversation over a technological device, and you're likely watching this through some kind of technological device, I still recommend that all of these things are available on paper. That it's not just about relying on electronic access to the information, because unfortunately, we don't always have the access we may be used to or take for granted. And so I like to say that no one ever has trouble logging on to a piece of paper, right? Or logging in to a piece of paper. In healthcare facilities, there are a lot of machines, there are a lot of different things going on, and it's not always easy to access information on one's phone or tablet, etc. And not all electronic healthcare record systems speak to each other, communicate and integrate with each other from one care facility to a next. So having that paper with you, make sure that that accurate information is available instantly as it's needed.
Can you, before you advance the slide, can you just
Sure.
briefly explain what the HIPAA, advanced directive documents, the difference between the healthcare proxy, living will, personal directive, because sometimes people can get them confused. And I know when we admit patients to the hospitals, there's a lot of questions being asked, and there's a lot of paperwork that needs to be signed. And after a while, the patients are just signing it because they have to, right? But they don't know what they're signing for. All they know is they're sick and they want to get better.
Right. And being a patient is a full-time job, right? And you're not at your best when any of your methodical thinking or any of your planning or all the skills that we work hard on as we develop can become secondary when we're the one who doesn't feel well and just wants to get better. So I completely understand that. So a HIPAA release, the HIPAA law is a law that protects patient privacy. And so because of that, unless someone is designated to receive information about a patient, once someone is over the age of 18 and considered an adult, you are unable to access information about a patient without that patient releasing information and signing a document that designates or assigns or says someone's name is able to pull up that information. And a few slides from now, when we look at sort of advanced care planning, there's also information about how you can say what you want included and what you don't. And advanced directives are actually named what they are. So an advanced directive means I filled out a document in advance directing people to the kind of care I want and what I don't, and directing who is going to stand in for me should I not be able to speak for myself. So a healthcare proxy, a proxy is literally a stand-in. When someone is not available, that person has been designated, has been assigned, has been chosen to serve as that advocate agent for that individual. That healthcare proxy form is literally just a form. It is a form that says, I, as Aileen Gerhardt, assign Susie Smith to be my healthcare proxy. In the state of Massachusetts, we have 2 witnesses that have to sign that. Neither one of those can be Susie Smith. And then that form is ready to go. I sign it as well. It does not require the presence of an attorney or an attorney to fill that out. However, that form only designates who I want to be able to advocate for me should I not be able to speak for myself. A living will, sometimes also called a personal directive, is a document that I complete that talks about the kind of care I want and what I don't want. And so the other thing to know about these documents is that, especially with a healthcare proxy, and especially when someone is admitted to a care facility, if you already have a healthcare proxy form in place, and hopefully as part of the documents you're bringing with you in your Go Plan or Go Bag, the healthcare proxy form, the most recently signed form, is the one in effect. And so sometimes when people get asked in a care facility, in a hospital, do you have a healthcare proxy? And again, as a patient, we feel icky. We want to feel better. We're not thinking our best. And you might interpret that as, do you have that form with you? And so the answer may be no, and you fill out another form, right? And that form is the one that goes into effect. So it's really important that you make sure that you've designated the people you want designated, and that you have those resources available to you as part of your organized documents. It'll make things easier for everyone in general. And we can touch on some more details a few slides from now.
Yeah.
Did that help?
Yeah, thanks for that clarification. Just one last thing. So, when you designate a person or 2 people to be your healthcare proxy,
right?
What do you recommend as far as letting those people know? I mean,
I have some slides on that in terms of also giving thought to what are good characteristics for a healthcare proxy. We'll get to that in a couple slides. So that we make sure we cover that information. The other thing that I just want to mention as part of when you're putting together documents is that you have something called a face sheet or some kind of instructive summary about you, so that if you're someone who wears glasses, uses hearing aids, uses a mobility device or something, that may not be necessarily reflected in your medication list you just put together or something else you just put together. And so again, at the height of the pandemic, when people were going into the hospital unable to advocate for themselves and unable to bring someone with them, papers like this, face sheets, instructive summaries, whatever works for you, were able to tell that individual's story and provide healthcare providers with information they might not have otherwise had. And so that's important. Same thing with if somebody has a pacemaker or a defibrillator. Make sure you have that information also in those records.
I think that's brilliant. When I was reading it, as you were talking, it's just so brilliant because it gives the healthcare provider instant information on how to best take care of that patient. You know,
Right.
I mean, if you could even add colostomy bags, I wear, I have a colostomy bag, or I have I don't know, artificial limb, and, all these
Right.
different things so that the care can be catered as best as possible for that.
Exactly. I'm left-handed. I prefer an IV or a blood draw in my right arm, et cetera, et cetera. So you're able to provide that information. And of course, the provider does want to have the best outcome for the patient. That's why they got into it to begin with, right? That's why all the schooling and all the work was to help other people. And the best way to help people is to have the most information about them. So it's just another useful resource to have with you. And again, to Debbie's point, you can customize it, whatever is most relevant to you. And certainly, make sure you do that as well. So these pieces of paper definitely should go at the top of the bag, because if someone were to open the bag, that information would be on the top. But people, if you're headed to the hospital for a while, you're somebody who has some kind of breathing challenge, make sure that extra inhalers or tools for treating COPD are available. If you're somebody who wants to have a tablet or an ebook reader or your phone, make sure that those are, ready to go, as well as chargers and those kinds of things. Books and magazines, hearing aids, extra batteries for hearing aids or a charger, depending on the kind, extra glasses, or reading glasses in general. If you're someone who wears reading glasses, have an extra pair already in that bag. And then also, you can also, for your own comfort, have disinfecting wipes and other kinds of hand sanitizers, to wipe down a surface that might be in your room so that you feel more comfortable in approaching a surface, etc. And then notebook, pens, and clipboard. Now, as a patient, sometimes it's hard to be really diligent about taking notes, although my next slide, I'll share that. But the other thing people also could consider bringing or have packed with them is different photos of people that are important to the patient, travel toothbrush, toothpaste, travel hairbrush, extra pair of socks, extra pair of underwear, and possibly a change of clothing. It's really important to not bring valuables and jewelry to the hospital. And then to Debbie's question about what should your emergency contacts and other folks know, you should make sure that they all have copies of whatever you've created. And emergency contacts also can be given the phone number to the nurse's station once you've been admitted to the hospital, because that is the most direct way to get information, is to speak with a charge nurse or somebody else at the nurse's station as well. They're the central point for the care of the patients on their floor. So, as a patient, we've talked about how hard it is, right? All we want to do is get better, and now I'm suggesting you bring paper and a notepad. Are you kidding me? Right? Why would I think that would be a good idea? Here's the reason why. If you have people visiting, or somebody who is able to accompany you, or depending on the type of care you're receiving, you have the energy or the interest, you can write down, or somebody helping you can write down questions and make sure the answers are recorded, so that, it's a crazy busy time. And so sometimes we don't know why something was being done, or why, and you can go back and look at the answer to that. It helps with identifying some goals, some concerns, etc. You might have for the care team, for doctors, for nurses, for occupational, physical therapists, respiratory therapists, speech therapists, etc. It's good to have those notes so when you leave the care facility, you have a record of what occurred, especially if medications have been added or stopped. It's good to be able to have a record of that. And that often happens as part of a hospitalization. And it also, having a notepad and paper gives you a chance to plan for post-discharge, for leaving the care facility. So what might be some supplies that are needed? That's a good place to write it down. Who might be the people that one needs to follow up with to make sure that there's home care and all of that. And so what are those resources and who might take care of that? That's another reason to have extra paper and notepads around. Recognizing that being a patient is a full-time job, and it's not entirely always easy for a patient to be able to take notes for themselves.
Yeah, I love this because I know as a nurse, when I see my patients taking notes, writing things down, I know that they are engaged and they feel a part of the plan, which, you know what, I always tell the patients they are the most important part of the team, because without them, there's no team. And they have the right to, to ask questions, to just keep asking questions and to listen to other recommendations from other specialists. They just have so many rights. And sometimes they have the white coat syndrome and they feel like, oh, whatever you say, and then they forget what was said and they go home shaking their head. What am I supposed to do? I don't know.
So having those records, those notes, they're also, and I recommend this for people when they prepare for medical appointments in general, non-emergency oriented, just routine, you can also ask your provider, whichever clinician you're seeing, nurse practitioner, physician, different kind of therapist, etc., whoever the clinician is, if they're giving instructions or explaining something that you want to get 1000% correct, you can ask if you can audio record that via your phone or a tablet. You need to have their permission. This isn't a gotcha. This is so that information is delivered exactly how the clinician intended it. And quite honestly, Debbie, to your point about white coat syndrome, right? The anxiety we all feel when we're in a healthcare setting of some kind, much different than when we're sitting in our living rooms, possibly watching something like this. So if you're hearing those instructions in the comfort of your home, you may hear them completely differently or hear them for the first time in a way that you did not in that care provider's office or certainly sitting in a hospital bed. And so that can be another tool. You just have to make sure that you get permission. It's in the clinician's best interest because it leads to fewer follow-up phone calls, messages in the portal, better outcomes for the patient. But I can understand why it could also be of a concern to a provider as well. So it's important as part of that team approach that we share why we want to record that information, should that be something we choose.
Right.
So, so advanced care planning, right? So, again, this is also named exactly what it is. We choose the kind of care we want and plan for it ahead of when we'll need it. So these statistics are from the Conversation Project, which is a great resource for advanced care planning. And so 97% of people say that it's important to put their plans and interests in writing, but that only 37% of people have actually done it. And why is that? Because it's overwhelming and stressful. And we also don't necessarily feel that we have the people we want to designate, or that we know what it is we need to do. And so to think about it as just planning in advance, and a lot of times people think of this as end of life care, but quite honestly, it's every day, because we don't know what's going to happen any day. And we might need a plan in place for an emergency, which is not about end of life care, but is just an emergency in the short term. So it's just something to think about. People really feel that they know how important this is, but it's so hard to get that done. And so we know that over time, it gives people a higher satisfaction with their healthcare experience. It prevents things like overtreatment or treatment by default, meaning something happens because there is no other plan. It gives the patient the input and that should always be an important part, as Debbie talked about in the approach to delivering care. That make sure that the patient's interests are first and foremost in the planning process. So a healthcare proxy, as we talked about a little bit ago, is simply a written document that designates a person's, it can be referred to as a healthcare agent, but it's somebody who literally will communicate with the doctor or other providers should the patient not be able to speak for themselves. And so that has to be in place for anyone 18 years of age and older. So if people are also thinking about children, grandchildren, nieces and nephews, as you're watching this, it's also important. It's not just about, as we are in the middle and later places along the age continuum, it's from the time of 18 on. And so it's good to remind folks that we need to make sure that anyone 18 and older has a healthcare proxy form in place, and HIPAA releases if that's also something that would apply as well. So the thing about a healthcare proxy, it can be designated for a temporary situation in the event of surgery or a sudden illness, or something longer related to something cognitively that develops, or a medical situation such as a coma, etc. But it is simply a written document. That's all it is. It's an important written document, but it does not spell out anything about the kind of care someone wants and someone doesn't. However, a living will does. And it's also called a personal directive, being that you're personally directing the kind of care that you want and don't want, which is really important. And you can write out what the things are that are important to you, the kinds of care you want, what you don't, things like often a do not resuscitate or do not intubate form. People often, when I discuss advanced care planning, bring up a MOLST form, or nationwide, it's called the POLST form. And here in Massachusetts, we're actually moving to the POLST form instead of it being called MOLST any longer. But this form was originally created for someone with a life-threatening serious illness that they then meet with their healthcare provider to discuss the kind of care and the kind of care they want and the kind of care they don't. There are many people who fill out a MOLST or POLST form. The difference with a POLST form and our living will and a healthcare proxy is that a POLST slash MOLST has to be signed by the physician. And the reason for that is because of that focus on serious illness. That being said, it's a useful form to look at, to give thought to what is the kind of care I might want and what is the kind of care I might not. But sometimes people are a little confused about how that form is different than these other forms. So it's just good to mention as well.
Can you,
go ahead.
Sorry, just before you move on, can you quickly define the difference between the MOLST and the POLST form?
The MOLST and the POLST are the same nationwide. We in Massachusetts like to rename things. So for us, it's called a medical orders. It has, the abbreviation is different, but it is the exact same form nationwide. And that form is usually printed on something like bright pink paper. And again, is something that when there's a diagnosis that is related to a serious illness, life-impacting illness, the clinician will then approach the patient to complete that form together. So they're both on the same page related to the care that the patient wants and doesn't want.
Is that per admission, or I'm just thinking if a physician approached a patient and it looked like the patient needed, it was imminent, and there needs to be clarity on what that patient wants the healthcare providers to do for them. All of a sudden, the patient, the health turns around and, the miracle has happened, and, they go home after 2 days and life is good. Does that MOLST expire in that admission, or does that continue to?
It continues, although you can ask for it to be removed from your record, but it's a form that carries over as part of your care. So it's a good thing to think about and know, so that you make sure the right paperwork is in place, to make things as streamlined and as easy as possible. Mm. So a lot of times what slows people down from putting together their advanced care plans is usually that they feel they don't have someone to assign as their healthcare proxy. And quite honestly, there's a lot of work that has to be done before you even can figure out who would be your best healthcare proxy, because you really should be giving thought to the kind of care you want and, of course, the kind of care you don't want. But when you're looking at who might be a healthcare proxy, you want to give thought to who would be the best person or people, because ideally you assign one person as your primary proxy and then someone as an alternate if that proxy isn't able or isn't available to be able to participate. And you want to make sure that that person is somebody that feels comfortable speaking with doctors and other medical providers, feels comfortable reading medical records and making decisions, etc. It is a form that does not require meeting with an attorney to complete it, because it's usually just 2 witnesses that sign the form, and those 2 witnesses cannot be anyone you've designated as a healthcare proxy. But that's all that form requires in order to be completed. So one of the things, now I recognize that we don't always feel we have people to ask to be a healthcare proxy. So what I, again, give a long list of, different things to consider when you're assigning someone, it's still important to think about that. I know that it may not be totally realistic in some cases, but you want to think about, is that person or individuals able to carry out decisions that are what you want and that are what you've asked for, even if they're different than someone else's personal belief. If they're emotionally connected, would that get in the way of being able to carry out what you've specified you wanting? Are they somebody that can speak up on your behalf and stand up for you, right? So the notion that someone who their personality is not someone who feels completely comfortable being assertive. And this is the suggestion about being assertive, not being aggressive. But if in someone's everyday personality, they don't feel comfortable challenging authority or feeling assertive, they're likely not to have some kind of personality change in the role of a healthcare proxy. And they may not be a good fit for this role. They may be able to play other roles that would definitely benefit you instead. But it's just something to keep in mind. Are they comfortable speaking up on your behalf? Do they feel comfortable asking questions of doctors and other healthcare providers and following up if they don't have answers? If they don't have clarification, are they able to, again, do that follow-up? All of those pieces are really important when you're thinking about who you might designate to be your healthcare proxy. So here's an example. So a proxy might have to make a fairly quick decision. Your parent has pneumonia. Do you want us to start antibiotics? And that may or may not have been delineated in a living will or other documents. Your friend is no longer able to take food by mouth. Do you want us to insert a feeding tube? So is that the kind of thing that the individual feels that with the right information, are they able to make an informed decision? That's something to consider as well. No one needs to be a medical expert in order to be a healthcare proxy, but they really should have a sense of your values related to what you want for your care.
And I could see how the living will can assist the healthcare proxy to make these decisions, so that way they know that they're making the correct one based on the patient's wishes.
Exactly. Right. They work hand in hand. So it's important that your proxy and all of your support team really understand what you've written out, what you've discussed. And also, and again, this is the proactive as opposed to the reactive, having these conversations ahead of time when you can share the things you want and don't want and can talk them through and can make sure that everyone's on the same page will have the best possible outcome for everyone involved. And so that's really important, even though we know these are hard conversations. We know these are not the first things we want to discuss with people, but they're incredibly important. And by discussing them and having a plan in place, the weight of not having the plan in place is lifted. And so it's a good thing to do and to make sure is revised whenever there's some kind of change in someone's life. That's important to go back and look at the documents that are in place. So for me, when I look at this process, I look at it first as, I sort of joke, it's advanced care planning in 4D, even though we don't have 4 dimensions yet. I know that. But we often people think about that designating as the first thing that needs to be done. And I like to shuffle it around so that you're thinking and deciding about what you want and what you don't want. Then you're documenting it for yourself and then for whoever you're going to designate. Then you designate and then you discuss so that you've done the work, that you know what you want and what you don't. And it may change who you might approach to serve as your healthcare proxy or as your alternate. It might not. You may not have the number of resources to be able to do that. But it is important to possibly think about it in this kind of way, as opposed to that first, oh my goodness, I need a healthcare proxy. And if I don't have a healthcare proxy, I'm not going to do any of these other pieces. And so that's one of the reasons I've shuffled it around a little bit. A great time of year to think about these things, to make sure this is part of your Go plan and plan in general. National Healthcare Decisions Day is April 16th. It's intentionally the day after we file taxes because, as it was said, there are two things you can't get away with in life, death and taxes. So if you've already filed your taxes on April 15th, the notion of a prompt to give thought to important healthcare decisions, April 16th is a good time to do that. And so there are all kinds of resources focused on visibility on that date, but all kinds of resources to encourage people to put their plans in place. And then, of course, once you've done that, make sure those documents are included in a Go plan you're creating. This is where there are a lot of resources on the screen. It's a good time to hit pause if these are resources that are new to you. But the File of Life, ready.gov, which is a government ready site for any kind of emergency, is a really useful tool when it comes to advanced care planning. Honoring Choices, Massachusetts, the Conversation Project. There's a fabulous nationwide resource in California called the Coalition for Compassionate Care of California. All of these resources not only provide you with template documents, but also help you, and this is the reason the Conversation Project is named the Conversation Project, have these conversations and give you prompts and tools to make that happen. And these are really important parts of any plan you're putting together. There are two tools that I like that are great launching off points. One is put together by the National Caregiving Alliance, which is a one-page form of where to find my important papers. You complete the form, you designate 3 locations as A, B, and C and say what they are. And then on this list, in these 2 columns on the left-hand side of the slide, you check off where these various documents are. And so it's a one-page sort of table of contents of where important documents are. And also, before you even fill it out, it's a prompt for all of the different forms that would be useful to have gathered. And so I really like that for that reason. So I suggest it for both of those reasons. And Everplans is a business that's whether you choose to do business with them or not is your own choice, but they have a number of free checklists on their website when it comes to putting things together for planning. And that includes things that we now have to think about, like digital estates. Do we have a list of all of our, even when you're thinking about putting together your healthcare records, do you have a list of your login and your password for someone to be able to get into your portal or electronic health record or any other kind of digital resources? So I suggest those as 2 launching off points. The HIPAA release form for the state of Massachusetts, again, available on the state's website, mass.gov. Any state in our nation will also have that available on their website. I'm giving the example of Massachusetts, but certainly every state in the country has these available to residents as well. It's good to think about how you want to organize this information both to keep it in a Go bag or as part of a Go plan, and also to have it easily accessible. So whatever your filing process is, that's what I recommend, whether that's a binder, whether that's a file in a file cabinet, something you want to decorate and really personalize, whatever it is. These resources that are contained in that plan are that they should be able to be grabbed and taken with. These aren't the things we might keep in our safe deposit box. That's a different plan. This is easily accessible, easy to pull off a bookcase, easy to leave at the top of a bag, that kind of thing. And so whatever system works for you, I always recommend organizing them and revising them so that you're able to put that together. So with that, I'll stop sharing. I'm sure, Debbie, that's elicited so many questions, right? A lot of information.
I'm looking at the time. I'm like, oh my gosh, what are my questions? So I love the last slide, the one that has the resource to include in your plan, because it does have, I love how it'll prompt people. It doesn't look intimidating.
No.
Very simple, but it's going to lead you through a path of decisions and discussions, right?
Right.
So that's actually a wonderful tool to start with. So one of the questions I had in mind, and I know that we're running out of time, but are any of these forms in Spanish and Chinese, different languages? That way
they are accessible in multiple languages. I know Honoring Choices and Conversation Project, 5 Wishes, the California resource, all are available in a multitude of languages. You can, and I believe a number of the additional resources that I recommended are also available in multiple languages, which is a really important point when we're thinking about accessibility, right? We want it to be something that someone can easily access, that it's overwhelming enough. We want to make sure that people can do it comfortably. So it's a great point.
Yeah. There's just so much to think about as far as, what to do just in case. And just the way you presented it today was, I loved how organized it was, how practical it was, but at the same time real, because there's just so many different dimensions of documents and really decisions to think about, even, the healthcare proxy. Who would people choose in their own circle to be the one that would stand up for you?
Mm-hmm.
I've taken care of patients who are married, they sometimes will not pick their spouse because their spouse they know their spouse and they know how much their spouse loves them. But when it comes to that decision, to those decisions towards end of life, they know that the spouse will be too emotional or
right.
may not agree with the decision of that patient. So they would pick maybe one of their grown, children who they know will have, the not the stamina, but, will be able to stand up for that person. And it's no reflection on the spouse, but like you said, there's other roles to be had.
Being honest about who we are, right? That if that's not our comfort zone, culturally, right, there are all these other dimensions to it we didn't touch on. There are cultural approaches to navigating and communicating with healthcare providers. There are generational approaches to navigating, and all of those are also factors. And that may play into who is selected, who is chosen, who is designated to serve as someone's proxy, because of those intangible but really important pieces when it's about deciding our care.
What is the contact information you could share with us?
So people can visit my website, which is beaconpatientsolutions.com. And there's information to contact me that way. There's a whole list of services I help with as an independent patient advocate, and other resources, some recordings, an educational library of some other talks I've given, etc.
So until next time, everybody, stay safe.